You're a healthy dude. You are in your early 30s. You have no pre-existing conditions, no diabetes, no major illnesses, no heart disease, stroke, cancer, any of that family history stuff. You're just a healthy dude. You quit your job from corporate America and you're trying to do your own thing, trying to start your own YouTube channel from home. You got a growing family. You got a 4-year-old and one's on the way maybe. I don't know. But you're a one-income family and you just need some type of health insurance for just in case crap happens. Your wife has group health insurance through her employer, but it's only cost effective for her because they only care about her. But for you, they don't care about you. You're going to be paying full price if you were to jump on your wife's group health insurance plan. So what are you going to do? Well, because you have no pre-existing conditions, you're not an expected father, let's say, eHealth is the way to go. The website is eHealth. All right, disclaimer. As this video goes on, the screen recording kind of glitches, and I have no idea why it's doing it. I'm using Camtasia. I'm editing it right now, and it is just fucking glitchy, and it's not my fault. It is my fault because I downloaded Camtasia, but I'm working on it. Eventually, the words do show. Eventually, when I'm typing out the examples. But it's pretty glitchy. I'm sorry.
Damn it!
Okay, don't go on healthcare.gov. That is not for you, especially if you're a young, healthy dude. Healthcare.gov prices will be at least 50% more expensive than the norm.
Fuck that shit!
Only if you got pre-existing conditions, go to healthcare.gov. And if you do have pre-existing conditions, go to healthsherpa.com, which is actually faster than healthcare.gov. But you don't need to go there because you're healthy. This video is about healthy people that are solopreneurs, entrepreneurs, and they just need health insurance for just in case.
Okay, I've got it.
So on this website, on eHealth's website, it shows Medicare options. That's only for 65-year-olds and older. This does not apply to you. Small businesses. Yes, if you're a small business that has at least like 3 to 10 employees, this would be good for you. Dental and vision, no. Individual and family, this is for folks that actually do have pre-existing conditions. You're under the age of 65, but you have pre-existing conditions. You got to see the specialist every 3 months. This is not for you.
I got a lot of shit to deal with.
If you're a healthy dude, this is what you put in. This is what you click on. Short-term medical plan. Your zip code, 606. Are you a business owner with employees? No, you are not. Oh, one thing to note. When you're on this website, read the fine print. It can be an affordable solution for those looking for limited health coverage. Limited as in like a health insurance plan that does not cover maternity, doesn't cover prescriptions, doesn't cover annual physicals. That's what they mean by limited. These plans lack the benefits of an ACA major medical plan, aka ACA means Obamacare. So it will not cover pre-existing conditions, but you don't need it. You don't have any pre-existing conditions.
You got that right.
So yeah, keep moving forward. Click next. You're a dude, you're born, again, sure, 84. You don't smoke cigarettes. Remove this spouse because she's got health insurance through her employer. Remove the child because the child is added onto the employer as well. Actually, let's say you have your daughter on here. And let's say she was born 01/2020. See plans. Because remember, your wife's employer, they only care about her. But when it comes to family members, dependents, spouses, they're going to be paying full price. So you want to include your daughter on this plan.
Oakley dokley.
eHealth is pretty much a search engine. It shows all the available health insurance companies based off of your zip code, based off of your age. Remember, you could do this on your own. You got to sort it by, let's say, company. How many players are available? Click on see more results. We see Allstate, Health Solutions. Allstate is not, what do you call this? Allstate is the carrier, but they are not the, it's not auto insurance is what I'm trying to say. You're not buying health insurance. You're not buying auto insurance. You're buying health insurance. Let's do a compare. There's another carrier called Pivot Health. Pivot! There's Everest, United Healthcare. That's pretty much it, based off of the zip code. So let me bust out a sticky note. You know, whether you have Pivot Health, whether you choose Pivot Health, Allstate Health Solutions, Everest, Sounds like a mountain.
No, it's a Rocky Mountain rattlesnake.
Everest or United Healthcare. Based off the zip code of 60606, there's only 4 non-Obamacare health insurance plans available for you. But the name brand doesn't matter at all. What really matters is how the doctors and the hospitals get paid.
You got that right.
And how they get paid is by the type of network that you have stamped on your medical card. So as much as possible, try to consider a PPO. Our distant second place is going to be an HMO. Then there's the EPOs and POSs. We're not getting into detail, that's for another video, but try to consider a PPO. A PPO is what you would want because providers, aka doctors, surgeons, hospitals, labs, they get paid better when they see the word PPO on your medical card. So that's what you want.
Alrighty then.
Luckily, the majority of all these health insurance plans have a PPO network. PPO stands for Preferred Provider Organization. You're gonna forget it. Who cares? Just know that doctors get paid well when they see the word PPO. That's what you'd want.
Okay, I got it.
You get the best of care. You don't need to go ask for a referral from your doctor. You don't need a blessing to go see a specialist like a cardiologist, podiatrist, dermatologist, and then you have to wait like weeks later. With the PPO, you could just Google the top cardiologist in your area and just go there, schedule if they're available.
Oh, okay. That's cool.
So there's Allstate. You can see how low it is. It could be as low as $156 a month for like a 30-year-old dude. Actually, how old is this person that I'm quoting? For a 40-year-old male. $10,000 is the deductible. Lasts 6 months long. After 6 months, it's going to terminate. Then you're going to have to buy it again. Capped at $1 million. That's the lowest plan. The most expensive plan is going to be $891.
Damn.
That's for a $3,500 deductible. $3,500 deductible. Once you meet the $3,500 deductible, everything should be covered at 100%, but that's not the case here because this is an 80-20 coinsurance after the deductible. So once you meet the $3,500 deductible, the insurance starts paying 80% of the bills, but you still have to pay another 20% of the bills, up to another $10,000.
I don't get it.
So let me bust out my sticky note here. So let's say a bad pickleball injury happened and you got hit in the eye socket and you need a new eyeball.
Eyeball?
Or a new eye. I don't know. Let's say it's just a really bad injury. You're almost blind and it's $100,000 from a pickleball eye injury. Your ass is going to be paying for the first $3,500 deductible.
That sucks.
Okay, but if you're in the network, you get anywhere from 20 to 30% average network discount. Let's say it starts at like $100,000. Let me bust out a calculator here. $100,000 times point. Let's say you get 25% off. So 25K off. So you have a $75,000 deductible, $75,000 medical claim balance. But you still got $3,500 to meet. So you're going to be paying for the first $3,500. So this $75K is after that 20-30% has been applied. In this scenario, it's 25% off. So what is $75,000 minus $3,500?
According to my calculation.
Okay, $71,500 is your balance. But this still needs to be met. So once your deductible is met, you only pay 20% of it, up to the $10,000 per person out-of-pocket limit. So what is 20%? 20% or 0.20. This is the 20% of the coinsurance. What's 20% of 71,500?
I know the answer.
Bust out the calculator again. 71,500 500 times 0.2 is 14,300. So 14,300 is more than this $10,000 out of pocket. So because 14,300 is more than 10,000, you're just gonna pay for the 10,000.
Noted.
So take the $71,500 balance, subtract the $10,000, which is your co-insurance out of pocket max. Co-insurance out of pocket. Stay with me. Stay with me.
I can't, I'm dying, I can't.
71,500 is going to be $61,500 will be paid by the health insurance carrier. And that health insurance carrier name is Allstate Health Solutions. It's a cheesy ass name, but that's what their name is. It's not auto insurance, it's the health insurance division. So there you have it. Out of a $100,000 pickleball eye injury, $61,500 will be paid. Your exposure is the $3,500 deductible plus your $10,000 co-insurance. So you really are in the hole for $13,500.
Fuck that shit.
And do you have to pay all that at once? No, you don't have to. Some hospital providers, they'll work with you. The hospital provider you work with, they'll finance with you, 0 interest. It could be $13,500 paid off in 12 months. Some providers even stretch it out to like 36 months. And if you do like $13,500 divided by 12 months, that's about $1,125 a month, $1,125 a month that you have to pay off this $13,500 medical bill balance. You got to pay that $1,125 a month plus on top of this this $891 monthly premium if you choose this plan.
Fuck that shit.
So here's an example. This is a video of this is a video example of somebody that's in their early 30s. Could be early 40s too. Let's say 1994. So it went from $891 to $791. If you're 10 years younger, you spend $100 less. So go to eHealth if you're a healthy dude and you just want health insurance for just in case an accident happens. Did I lose you? Did you get it? Did that scenario relate to you? Did it not? Did you fall asleep? If you have any questions, just DM me on TikTok or Instagram, Major Medical Beef. No spaces, just Major Medical Beef on TikTok or Instagram, and you'll find my face. But if you want me to do a similar situation like this, based on your situation, just let me know, DM me, and I'll create a video specifically related to your situation.